You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. With us, we have North Carolina's go-to board-certified plastic surgeon when you want to look years younger after pregnancy. With us, we have Dr. Victor Ferrari. Dr. Ferrari, welcome to the program.
Thank you for inviting me, Randy.
All right, now, before we get into today's topic, for people that don't know you and your practice, tell us a little bit about your practice. Who's your typical patient? What are the different services that you offer?
Yeah. Well, I've been in practice over 20 years, and the last 15 years I've dedicated it completely to cosmetic surgery. In terms of a typical patient, I don't know that I have a typical patient. About 90% of my patients are female, 10% are male. They come in all ages, from 20 to 70.
So do you have kind of a spa environment? I mean, you do everything, not just surgery. Is that right?
That's correct, yeah. In our building, which is totally our building, we have a spa and a surgery center, all combined. So we do small procedures, Botox, microdermabrasion, lasers, for people that don't want invasive things. And then we do the big, giant, extreme makeover body contouring procedures.
Now you're known for body work, I've been told.
Correct, yeah.
So what defines, I mean, a working definition, when you say body work, what does that mean?
Yeah, usually it's things that we do from the neck down to rejuvenate people or make them look better than when they were younger. People go through a lot of changes in a lifestyle. And because of that, sometimes they lose confidence in the way they look, and it affects all aspects of their life. So one of the rewarding things about what I do, I regain their self-image, or maybe even improve on their self-image, and all of a sudden their whole life changes in a lot of different areas, not just privately at home, but also socially and career-wise. It opens up a whole different world for them.
Now, mommy makeover, jumping
Yes.
right into it. What defines it? Like, what is it? And do people call it that? Like, do women say, hey, I want a mommy makeover?
A lot of them do, yeah. Now, before we get into that, let me just first say, being a mom is one of the most fantastic things a woman can undergo. It's a beautiful time of life. I mean, obviously there's a lot of joy associated with that, but there is a flip side. There are some serious physical changes that occur in a woman's life after she's had pregnancies, okay? Especially more than one pregnancy. A lot of changes. And I'm talking head to toe changes. There's facial changes that occur. There's breast changes that occur. They deflate, they drop, they lose volume, they lose projection. The abdomen is probably one of the biggest areas that changes. I mean, when you have such a quick enlargement of the abdomen, on top of the fact that when women are pregnant, hormones are given off to weaken connective tissue so the baby can come out. All that causes weakening of everything, and that's when stretch marks appear and things like that. So the mommy makeover, we're trying to reestablish what they look like before they were pregnant, or maybe in some cases make them look better than they've ever looked even before they were pregnant. That's the goal of a mommy makeover.
So when should a woman come in for a mommy makeover?
Yeah. Once she's done having children, when a woman gets to the point that she says, you know what, I'd like to look better in clothes. I want to wear that tight dress again. I want to wear a two-piece swimsuit again. I'm just not happy with the way I look in the mirror. That's the time to come in. There's so many wonderful things we can do now. There's really very little reasons not to undergo some sort of procedure if it makes you feel better about yourself.
Now, there's a lot of people, this is a very popular procedure.
Yes.
Where you are. On a consultation,
Yes.
what do they say? Like, what bothers them the most, I should say?
Yeah.
That motivates them to do something?
Yeah. Here's a very common scenario that we get all the time. Women, they have children, they've gained weight, they've done the diet, the exercise, they can lose some of the weight, but now they're a different person than they were before they had kids. And what I mean by that is, hormonally now, the body attaches fat to some areas that they never had fat before. Maybe it's the love handles, maybe it's the outer thighs, the saddlebag area. And they say, no matter how hard I try, I just become a smaller version of the same shape. I can only get so far. On top of the fact, they've got loose skin, okay? It doesn't matter how much you work out, Randy, that loose skin is not going anywhere. And if it has stretch marks, it means it's been stretched beyond its ability to repair itself. And luckily we have lasers now that can handle that. But there's a lot of changes that go on. And women work hard to look a certain way, and they just can only get so far. They need our help. On top of the fact, think about motherhood. What is a mother? A mother is somebody who sacrifices for her kids, right?
Yeah.
Well, there comes a point in life where you go, you know what? Now my kids are a little bit older. They're off to school. Now it's my turn to do a little bit of something for myself. There's nothing wrong with that. It should be something that, you know, now let me get some of my youthfulness back. And back to your original question, why do they want to do it? I've had some patients that say, you know what, I want to wear a business suit again and I want to look good in it. I want to be back in a two-piece swimsuit. I want to have the same breast fullness that I had before. I want to look good in a tight cocktail dress. Everybody has a story. Everybody has I want to have the lights on at night when I'm with my husband.
Okay.
You know, a lot of them don't do that anymore, not since they've had kids. That's oftentimes their motivation.
What are the age ranges, by the way? Sorry to interrupt, but what are the age ranges people are doing this?
Normally, most women come in for mommy makeover when they're in their mid-30s to mid-40s, somewhere in that range. By that time, the kids are off to school, they're not home all day with the kids, having to take care of little ones, changing diapers, that sort of thing. And now they're thinking, you know what, now would be a good time. Now I'm not so, that the kids are not so dependent on me that I have to be picking them up and doing all these other things with them.
Okay, great. Now, for people just tuning in, we're talking to board-certified plastic surgeon, Dr. Ferrari, about mommy makeovers. And people need to know it's a real interview. I'm not siding with you or endorsing you, but the photos that we're going to have time to show are absolutely dramatic. And they are makeovers, right? It's like extreme makeovers.
Right.
So go ahead, show us a couple of these photos.
Okay.
And what are we looking at here?
Now some of these, because they show upper body, I can't show part of it on camera, but let's look at this woman here.
Okay.
As you can tell, she's had a few kids. She's lost a little bit of her abdominal flatness. This woman works out all the time. She goes to the gym, she diets, she exercises.
Looks pretty fit.
She's very fit. She has very little body fat. And so you can see on her front view, she has a little bit of a belly button hernia, not a big deal. She looks pretty good from front, but look at the side view, Randy.
All right.
Notice the bulging abdomen, okay? No matter how much she works her abs, she says, I just can't get this to lay flat again. And why? I'll tell you why.
Good question.
The rectus muscles, the vertical six-pack, that has been torn apart by pregnancy, and it's a weak spot in the middle of the muscles.
So it like stretches?
Exactly, and it balloons out. And oftentimes, no matter how hard a woman tries, there's still a little ballooning. Now, the other thing you might notice about this picture, she has very little breast tissue left.
Yep.
She was very voluptuous and full before having kids. After she breastfed, she says now they're like deflated little bags. She goes, I want to get my fullness back. And one is bigger than the other. And that's very common as well. Can we fix that? Absolutely. And we can fix it in such a way that she can go back to working out and not having a problem with working out. She wants to keep working out.
Now, when I look at that, it doesn't look like she is a tummy tuck candidate.
Yeah, yeah. And some surgeons might look at that and go, oh, she needs a little bit of liposuction. But she literally had maybe a 1/4 inch of fat. Liposuction would have done nothing for her contours. Wouldn't have helped her at all.
So you had to kind of tighten, like a girdle?
Exactly.
Kind of a thing with a tummy tuck?
Yes, with the tummy tuck, we removed some extra skin, fixed her hernia, but brought the muscles back together in 2 layers and put them back to where they used to be before she ever had kids.
So you kind of like sew them back together?
Yes.
Like that six-pack is tight.
Exactly. Internal stitching. You never see the stitching. It's all internal, but it does bring the muscles back to the middle and helps flatten everything and put it back in its proper place. And now look at this after, Randy.
Wow.
You can see the breasts are now symmetric. They're perfectly even. The abdomen is perfectly flat the way it was before. You can even see her six-pack on the side view now again.
Very
Whereas
nice.
Before you couldn't see it. And she hasn't really lost any weight on her own. This is all a surgical result. Now, and let's talk about the incisions, Randy. Here's one thing that I insist all my patients do. Bring in a swimsuit. Bring in underwear that looks like your swimsuit. My goal is to get everybody back in a 2-piece swimsuit. A lot of my patients laugh at that. They're like, oh, I won't be in a 2-piece swimsuit again. But I would say the vast majority of all my patients end up back in a 2-piece swimsuit. We put it low, we put it where their swimsuit hits it. It's never seen. Now she can wear tight-fitting clothes, a nice tight cocktail dress. She can wear her tight-fitting clothes back at the gym. She used to wear a t-shirt and shorts. Now she's back in her tight-fitting clothes. She has a different presence about her. This is very common. We see this all the time. It changes people's perspective of themselves. When they walk into a room, you can tell they're standing taller. They feel better about themselves.
So like adds to their charisma in a way? Because you feel great about yourself?
Absolutely. And it affects everybody in the room. Because when you feel good about yourself and you walk into a room, people can sense it. There's an energy about yourself that you didn't have before. Okay? But when you don't feel good about yourself and the way you look, you're kind of a little wallflower. You don't want to be, too much out there. You don't want to draw attention to yourself. Now these people want attention drawn to themselves. And you can tell 100% of the time, when they come back for the 3-month follow-up, 90+% of them are dressed differently. totally differently than when they walked in the door, okay? They don't have the loose clothes anymore. Now they have something form-fitting. They feel good. They want people to notice that they look better. They hear people say, wow, what'd you do? You know, did you lose a lot of weight? What happened to you? You look great, you know? Who doesn't want to hear that? Everybody wants to hear that. It's just comforting to know that other people find you attractive as well. Now, Ray, let me show you a completely different situation going on here, okay? This woman, 40 years old, okay? Now, I want you to notice a few things about her. She came in originally complaining that, you know, now what? Now I've got saddlebags. I never had saddlebags before I had kids, and now I've got saddlebags. I don't like that. And I used to have a very nice backside, and now it looks kind of deflated. As I've lost weight trying to get my saddlebags to go down, I've lost the contour for my backside. I don't like either one of those. What can you do to help me? And I said, well, we can hit 2 birds with 1 stone. I'll tell you what we're going to do. I said, we're not going to put a buttock implant in you. That's not going to fix it for you. And plus, who wants an artificial implant if you can avoid it? So what I did, I said, let's liposuction your outer thighs, harvest that fat, purify it, and re-inject it into your backside and give you that nice curvaceous buttocks again. And that way, you've killed 2 birds with 1 stone. You've addressed both problems in the same sitting. Okay, so this is a different type of situation. People, you know, are more sensitive to their backside now as well, especially when you have actresses like J-Lo and the Kardashians and all that. Now people want their backside to look good as well. It's not. It used to be all about breasts. Now it's also the backside too. So we can fix that as well. And here's one thing I like to do in the consult. I take the patient's cell phone. I say, "Can I take a picture of you?" And we take a picture of their backside. They never see that. Okay, they never see their backside. How many people look at their backside? Very few. So as we're looking at the photo together, I say, look at this, we can fix this, we can fill this out, we can sculpt this, here's what we can do to make you look better. And now all of a sudden they have a visual of what is possible.
Is there reaction sometimes like, oh my goodness?
Yeah. They say,
because it's like getting on the scale.
That.
You don't want to look at sometimes the scale numbers.
Yeah.
You definitely don't want to look at your backside sometimes.
And they say, you know what, you're the only one that's ever done that. I'd kill my husband if you try to do that to me. You know, so I have privilege somehow to be able to take a picture of their backside. But it's for educational purposes, to educate them. What can we do to make this whole situation
So she was
better?
bugged by her saddlebag area.
Yes.
Bugged by
the buttocks deflation.
Okay.
Yes.
Okay. So you did a combination of
liposuction and a fat graft at the same time.
Okay.
And here's her 3-month follow-up photo there.
Very nice.
And if you look at her buttocks, now it has a nice fullness again. Now the outer thighs are still slightly swollen. That's going to get a little bit better. This is 3 months later. Sometimes it takes them 6 months for the swelling to go away completely. But you can see at 3 months, this is pretty dramatic now. And she said, you know what, now I can wear my tight dress again. I'm not embarrassed. She wouldn't wear it before. Now she has a different attitude about herself, okay? And her clothing is changing. She can wear the tight yoga pants now. Before she used to wear shorts and a t-shirt to the gym. Now she can wear the tight yoga pants and feel proud about that, okay? Because now everything's back in balance. She's sculpted, she looks good. And she could never have done that in the gym by herself. You can't build that deflated buttocks back like that. You can't necessarily get rid of the saddlebags. You can become a smaller version of your same shape, but you can't burn off the saddlebags just by working your outer thigh a little bit more. It doesn't work like that.
So the saddlebags won't really come back, and with lipo, the fat cells are gone.
The shape is forever different. Whereas if they lose weight, they take big saddlebags and make small saddlebags, but they still have saddlebags. We can eliminate them completely forever.
Now, we've talked on the telephone. You also work with large patients.
Yes.
For these mommy makeovers.
Yes.
You're not afraid of these patients. In fact, and I don't want to put words in your mouth, but you'll do things that other doctors maybe don't want to touch.
Yeah, I've been doing larger people since the mid-90s, before anybody was doing them. And I love this kind of surgery. It is so life-changing, Randy. These people have been to other plastic surgeons. A lot of surgeons said, you need to lose a lot more weight before we can touch you. And that's not really true. Let me just show you this case. This is a classic extreme body makeover that I've done.
You're proud of these photos, by the way.
I love
it's like you're showing me baby photos.
Yeah, yeah.
Okay.
I mean, and you know, I develop a friendship with these people. They come back to the office, they hug me. They're like, I never dreamt this was possible. And when you see these pictures, you'll see what I mean.
Wow.
This woman, 36 years old, okay?
That's got to be unusual.
Yeah. You know, Randy, it is not that unusual. I see probably 2 or 3 of these a week in my office.
Really?
People come in, yeah. We see this very, very frequently. And the reason we don't see these kind of people very often is because where would you see these people? At the beach, right?
Yeah.
Do these people go to the beach and put on a bikini? No.
Good
they
point.
might go to the beach, but they're going to have some very loose-fitting clothes, so you may not know what.
Do they even come in and say, Doc, this is the worst you've ever seen?
Oh yeah.
Do they ever say that?
Oh yeah, all the time.
Oh really?
They say, they say, I'm so embarrassed. I'm sure you've never seen anybody like me. And then we look at it, we go, yeah, we see this quite frequently. A lot of these people, they've maxed out what they can do. They've hit a plateau. They've done the diet, the exercise, and now they've got loose skin, and it's very uncomfortable to run or to exercise or to do anything. And so they're kind of stuck. And so if we can help these people, then they can go on and lose a little bit more weight on their own. And we see this all the time. So I get a lot of patients that other plastic surgeons won't touch.
So what do you do for her? I mean, when you look at this abdomen,
Yeah.
I mean, what goes through your mind? Like,
Yeah.
what are you thinking I've got to do?
Yeah. Well, we went through the whole consult, explained the options, and I said, in a perfect world, would you be back in a two-piece swimsuit? And she and most of the patients go, I'll never be back in a two-piece swimsuit again.
Okay.
That's crazy. Like I haven't been in a two-piece since I was a teenager, right? Okay, I get this all the time. And they go, well, yeah, I'd like that. I said, okay, here's what we're going to do. The day of surgery, you bring in a two-piece swimsuit or bring in underwear that looks like your swimsuit style. We're going to design the surgery so you can be back in that two-piece swimsuit. Okay, so let me tell you what I did for her. Okay, 2 things. Number 1, large volume liposuction. Over 5 liters of fat was taken out. If you think of a liter of Coke or a liter of soft drink, 5 liters taken out in one sitting. And then I did an extended tummy tuck where we not just go in the front, we actually go all the way around with these tummy tucks. Some people call them circumferential tucks, lower body lifts. They have different names to them. I mean, it's amazing how we change people's lives with these. Okay, I'm going to show you the
All right, okay.
Let me slide these over. Okay.
Whoa.
Now these are 6
Wow.
months post-op. Okay. Now notice a few things. The loose skin is gone. She is thinned out tremendously. The scar is hidden into place. And Randy, notice her tan lines. Is she back in a 2-piece swimsuit?
Yeah.
She is back in a 2-piece swimsuit. She never dreamt it was possible. When she
I mean,
came
this
back,
is really dramatic.
it's beautiful. And
It's like you have to hold a press conference on this one. I mean, this is really, and this is common. I mean,
Yeah.
really.
Let me tell you a beautiful thing. When this woman came the first time, she had very loose fitting clothes. When she came back for her 6-month follow-up, she had just come from the gym. She was wearing a little top here. You could see her belly. And she was wearing those tight yoga pants. And she's walking in like she owns the place, Randy. Her confidence level went from here to here, here to here. It's just amazing, the transformation. So it's not only a physical transformation, which is quite beautiful, but there's an emotional transformation. There's a new confidence level. There's on so many different aspects of her life have become different because of that. Socially, with her husband, everywhere. I mean, we hear this all the time, Randy. And look at her backside. Now,
I mean, that's
we got rid of the rolls. Now her backside is attractive. It's sculpted. It's pretty. She can wear tight clothes proudly.
I'm not trying to side with you here, but I think, I mean, anybody watching this is very, very dramatic.
Yeah, well, thank you. Yeah, and we have a lot more photos that I couldn't bring. I couldn't show you. The patients didn't agree to it.
No consent,
So,
okay.
so we have to respect their privacy, but we have many other patients.
I mean,
just
this is
as
a
dramatic as her.
transformation.
Yes.
When you do this. So, full mommy makeover. Again, for people just tuning in, could be a little bit of breast, a little bit of maybe a tummy tuck or liposuction.
Yes.
And maybe even some things to their face.
Yeah.
Is that right?
Yeah, or it could be something as simple as stretch marks. Some women just come in for stretch marks. And so that's a non-invasive thing we can do with a laser and smooth out the stretch marks.
And we're running short on time. And I know you wanted to talk about the people that have lost a lot of weight after, like weight loss surgery or
Yeah.
just after
Yeah.
losing weight.
Yeah.
What do you do for them?
Well, there's a lot of things we do. One of them, you just saw a classic example of something, even though she didn't have gastric bypass or anything else, we have a lot of patients that come in after major weight loss, 100 pounds or more. Let me just show you an example of something else. Here's a woman that came in complaining of her arms. Now she had gastric bypass, lost over 160 pounds, but she said, you know, Dr. Ferrari, I want to get back in the business world. I can't put on a business jacket anymore. My arms just don't fit. And I've lost the weight that I can. I've plateaued, but I've got this skin. It just won't fit. It's too tight. What can you
So
do?
is that just liposuction you're going to do?
Yeah. No, it can't just be liposuction. The skin will not shrink back. And she has these angel wings. We need to get rid of the extra skin. And maybe some liposuction in certain cases as well. But liposuction alone would not cure this level of angel wing, as we call it. Okay. So in her, a little bit of lipo, but the major thing was removing this enormous piece of skin from her elbow to her underarm. Okay. Now there is a scar from the elbow to the underarm. Okay. But look how much smaller her arm is now.
Wow.
Now, we see a lot of patients like this with the big arms. And imagine, even driving a car would be difficult. Certain clothing's not going to fit. Some of them say that their grandchildren or children play with their arms. It's very embarrassing. Most of these people don't ever wear a short sleeve shirt. Even if it's a hot day and they're out by the pool, they put on long sleeves. They don't want their arms to show at all. And so this is very life transforming for them. Now they can wear short sleeve shirts if they want to.
So for her motivation was business.
Yes.
Wearing business shirts.
Yes. And now business shirts and
I mean, it's like they're half
jacket.
the size, these arms.
Oh, at least, yeah. Yes. Even more so.
So you're just cutting it out.
In her particular case, yes, we removed the skin and the fat altogether.
Now we're out of time, just about. And I know you wanted to talk about the leaner patient that after pregnancy, their abdomen does not bounce back, or they have a lot of stretch marks.
Yes.
So what are you doing? I mean, surgically, because I think you said, because I said you could get rid of 6 inches of stretch marks, and you said, well, more than that. So what are you doing?
Yeah. Yeah, a little depends on the patient, how much loose skin they have, but we can just physically remove the lower abdominal skin, stretch it back down, put the scar low, that can be back in a 2-piece swimsuit. If there's any leftover stretch marks that maybe we can't get out completely, we have a laser we can cure that with. Okay. We've had a lot of women that look fantastic in their clothes, but out of their clothes, the stretch marks are a dead giveaway, that things aren't quite right.
It bugs them.
It bugs them, and they won't wear a 2-piece swimsuit either. Even though they got a great shape and they're healthy and fit, the stretch marks are the deterrent for wearing a 2-piece again.
Okay, let's move up to the breast for a moment. Okay. Breast lifting, a big part of this procedure.
Yes.
So tell me a little bit about your technique. What about incisions? What do women want to know? What are the frequently asked questions when they come in?
Yeah. The first question is, do I even need a lift? Okay, and I can tell you over the last 20 years, my thinking has evolved because when I was first in practice, I wanted everybody to have the perfect ideal breast, okay, with the proportions, 55%, 45%, you know, there's certain mathematical formulas that define what is an ideal, beautiful breast. Not everybody needs that or wants that. And then it struck me one day, hey, what's an ideal breast at age 20 is not necessarily what a 40-year-old wants. Okay, a 40-year-old might be just as happy with a little bit of a droop going on there because that's a natural look for a 40-year-old. So don't insist as a plastic surgeon that everybody needs a lift to get the ideal proportionate breast. And so I'm actually doing less breast lifts than I was doing 20 years ago because I've recognized the fact that a breast that is a little bit low with no scars on it might be better than a breast that's perfectly proportionate but now has scars on it. But now there are women that obviously need it. In other words, if the nipple is pointing downward or hangs too low, that's not an attractive shape. Okay, so we do need to fix that. We do a lot of techniques where there's the minimal amount of scarring possible, which means just a little scar around the areola or the nipple area, and that's it. And we can kind of hike things up that way and tilt the nipples back up where they're supposed to be. Now, if they need a lift, chances are they were bigger at one time and now they've lost volume. So they've lost volume, they've lost projection. Well, now we need an implant as well to restore the beauty and youthfulness of that breast to give it that plump, young look. Okay, so sometimes we need to combine lifts with implants. Now, a lot of surgeons will not do both the same day. They will do
a lift and an implant.
They will not. They will do the lift one day.
Why?
Because they're concerned that you're making the skin envelope smaller and you're making the breast bigger the same day, and you could decrease the blood flow and cause some problems in wound healing. But well over 15 years ago, I started combining the two with certain techniques that allows us to very safely do both at the same time. Okay, and that way we can put the implant in and do the lift the same day. And whether it's a small lift or a full lift, I've been combining them for a long time, and we've had very good results.
How much is art, and we are really out of time, but how much is art, how much is science in your mind? I mean, do you have to really have an eye for this to get great results?
Absolutely. If you don't understand what the ideal, beautiful look is, I don't care how gifted you are with your hands, you're not going to get good results. It just doesn't happen. You have to be able to envision the end result. Or what are you aiming for? What are you doing?
So you see it in there
yeah, I see
the end result?
I see it way before. I practice the surgery in my mind several times before we actually get to the OR. So by the time I get there, I've already done it in my mind several times. I know exactly what we're going to do, which saves a lot of time. If you're going to sit there and try to figure it out the day of, it's going to take a lot longer. It may not come out good. You've got to be able to figure it out ahead of time. And that way, the day of surgery, it's almost like a no-brainer.
And you believe you're changing people's lives?
I know I'm changing people's lives. Every day we see it, all the time. Their confidence, their abilities, their the way they feel about themselves. It's very rewarding.
Do they ever just want to hug you? I mean, like I looked at
All
this
the
one
time,
before
yeah.
and after. It's
Yeah.
like, that's a big deal.
Yeah. Oh, I get hugs. I get thank you cards. They send me gifts. Yeah, it's so much fun, Randy.
Well, good for you. Okay, so if somebody wants to get involved, they go to your website, they could take a look there, but get a consult with you. That's where it begins.
Yeah, no, we have a lot of people around the country that come, and I will have them securely email some photos. We can have a consult over the phone even before they come. We have people come all the way from California to North Carolina. I still have people, I was in Miami for 6.5 years. Some people from Miami still come see me. I like to do a consult ahead of time so they know what to expect, to make sure this is the right thing for them before they fly all the way out to North Carolina to see me. But yeah, there's a lot of options. We like to take care of people as best as possible.
Do you want them to bring in their partners or spouses, whatever the case may be? Or
yeah, definitely. The person that's going to take care of them needs to be on board and needs to know what to expect and how to take good care of them. And so it's ideal if they can bring in their partner.
You told me there are certain husbands, you mentioned one in particular, that they talk their wives out of doing things like this.
Sometimes they do. And here's the classic. I hear this all the time. The woman will be talking about her abdomen, and the husband will say, well, you know, if you just worked out more at the gym, you'd get a flat tummy without surgery. Look at all these bodybuilder women. They have flat stomachs. Well, the problem is these bodybuilder women probably haven't had any kids, right? So yeah, they're going to have tight skin because they haven't had children. So guys, never tell your wife or your significant other, hey, you can just work this off. The skin can only go so far. And the other people that are telling them not to have surgeries are personal trainers. They go, oh, we can take care of this for you. We just need to train you a little bit harder. That doesn't work either. There's a point where diet and exercise have a limit and they plateau, and that's all they can do.
And these procedures have become mainstream. I mean, for the last 20 years, have you seen, so you've seen huge acceptance
yes.
of these procedures?
Yes. And TV shows like Extreme Makeover have helped that to be possible. Extreme Makeover show was instrumental in showing people what are the possibilities. A lot of people didn't even know this could be done safely or could be done at all.
Yeah.
Yeah.
Well, I want to thank you for coming on the show.
Thank you for having me.
Great
Randy.
stuff, and they can look at these photos on the website, and a pleasure to have you come in. And we kind of begged you to come down here and get you on the show, so thanks.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.